need more masks, visors and surgical gowns to protect them from coronavirus, warns the Doctors' Union, otherwise some may die. This is the protection they should have, but the BMA says there's growing evidence that it is not available for thousands who need it. One nurse pleads with the public to stay at home.
Guys, you need to stay indoors. Like, I'm petrified of going to work. I'm petrified, but I have to go to work.
Prince Charles is self-isolating at Balmoral after testing positive for the coronavirus. His symptoms are said to be mild. Under pressure, nearly 500,000 people have filed welfare benefit claims since last week, with more than 100,000 applications made yesterday alone. An ice rink in Madrid becomes a temporary mortuary as Spain's death toll overtakes China's. Plight of the homeless in the face of this crisis, how some are being offered hotel rooms to give them some sort of protection.
Firstly, I'm volunteering to do some driving for the NHS.
And a new army of volunteers. More than 500,000 people have stepped forward to help care for the most vulnerable.
Also tonight, we look at the impact the virus is having on the self-employed, their lifestyle and of course their finances. We'll also look at how most Londoners are changing the way they live day to day.
Good evening. Frontline medics have told the BBC about their concerns over a lack of personal protection as they fight coronavirus in the UK. The British Medical Association says there's growing evidence that thousands of frontline doctors are still not getting the equipment they need to treat patients with coronavirus. The Doctors' Union says it means some medics are likely to become very ill and some may die. But the government says 15 million masks have been delivered to NHS trusts across the country since Monday. 41 more people have died in the UK from coronavirus in the past 24 hours. They were aged from 93 to 47. All had underlying health problems except for the 47-year-old. It brings the total number of deaths to 465. Meanwhile, more than 500,000 people have now volunteered to help care for some of the most vulnerable people over the next 3 months. With more on the challenge facing the health service, here's our health editor, Hugh Pym.
I am 39 years old, and
Karen is 26 weeks pregnant. She wants everyone to know just what it's like to have coronavirus.
I've just been told that I have COVID-19, and I've been ill for 2 weeks. I've been in the hospital now since Saturday, and today is Wednesday. I have pneumonia in both lungs, and I'm fighting for me and my baby.
The virus can infect all ages. 5-year-old Alfie has been seriously ill with symptoms. He's back now from hospital and recovering at home, but his mother Lauren thought at one stage she might lose him.
Obviously I've seen it all on the news where everybody's got coronavirus and then the next thing people are dying from it. And to see him so poorly, I didn't think that he was going to be able to come back from it.
For doctors and nurses treating patients, supplies are urgently needed. This sportswear firm in Northern Ireland has a major deal to produce scrubs for NHS staff. But there are reports there still isn't enough personal protective equipment in some hospitals and GP surgeries, even after recent government commitments. And the British Medical Association, representing doctors, says its members are being let down.
Prince Charles has tested positive for the coronavirus. Clarence House says he is displaying mild symptoms but is otherwise in good health. The Duchess of Cornwall has also been tested but does not have the virus. Here's our royal correspondent Nicholas Witchell.
Birk Hall today, the Prince of Wales's home in the Scottish Highlands. It's here that the heir to the British throne is self-isolating, as is his wife. They'd arrived here on Sunday night. He was already showing mild symptoms. He was tested on Monday. The results came through late last night. In a statement, Clarence House said, "The Prince of Wales has tested positive for coronavirus. He has been displaying mild symptoms, but otherwise remains in good health and has been working from home throughout the last few days as usual. The Duchess of Cornwall has also been tested, but does not have the virus. Scotland's chief medical officer stressed that the Prince had been tested in line with normal procedures.
He was tested for clinical reasons. I'm very pleased also that he is very well, and as with many people who have had this virus, has had a mild illness.
The Prince has met hundreds of people over recent weeks. On the 6th of March in Newquay, he was still shaking hands quite freely. On the 9th of March, he was at Westminster Abbey with the Queen. Handshaking was out. Charles adopted the Indian Namaste greeting instead. But 2 days after that, on the 11th of March, he was evidently having difficulty remembering the no handshaking rule. At that stage, it was still something to laugh about. On the 12th of March, the Prince was at Buckingham Palace for an investiture. He also briefly met the Queen. Buckingham Palace is usually pretty sparing when it comes to information about the health of senior members of the royal family. On this occasion, though, the palace was quick to say that the Queen remains in good health. The Queen left Buckingham Palace last week for Windsor, where she's been joined by the Duke of Edinburgh. According to the palace, all appropriate advice is being followed to shield them from the virus. Nicholas Witchell, BBC News, Buckingham Palace.
Now recorded more coronavirus deaths than China. 738 people with the virus died in the past day alone, taking the total over 3,000. Italy still has the highest death rate though. More than 7,500 people have died and over 75,000 have been infected. But the infection rate has slowed for a fourth successive day. In France, more than 1,300 people have died. Almost 3,000 people are in such a serious condition that they need life support, meaning more than 1/3 of France's ventilation beds are occupied. There's a similar situation in Spain where more than 2,500 are in a serious or critical state. Almost 3,500 have died there. Our correspondent Damien Grammaticus joins us now from Madrid. Damien.
Sophie, yes, that bald fact here has been really shocking for many people, that Spain now, a country of 47 million people, has registered more deaths in this virus outbreak than China with its more than 1 billion people. Hospitals here are swamped. Every effort in Spain now is being mobilised to try to fight the virus. But what has really, I think, shaken people is that death toll. 738 in the past 24 hours, the highest of any country in the world today.
On a dark day for Spain, a sobering sight. Van after van carrying bodies of virus victims. This is Madrid's biggest ice rink. It's been requisitioned to hold the dead. They need it. There are so many now. Arriving at Spanish hospitals are more and more cases. Infections here leaping every day. More than 5,000 medical staff have fallen sick too. So part of Spain's urgent efforts are these new rapid testing centres, specifically for those in the front line. Toñi Osuna, a nurse, fears she has the virus. A colleague has it. The swabs are invasive, unpleasant, handled with extreme care in case they've picked up the pathogen. Tony's worried she has a family she might have infected too.
I'm very worried, especially for my family and my patients. At home, I stay in one room, isolated, treating myself for my symptoms alone.
So the whole of Spain has now mobilised to fight the virus. A tanker load of chemicals arrives at an army base on the edge of Madrid. Inside, they're now making hand sanitizer, gallons and gallons of it, to supply hospitals, so great is the demand.
What we are doing is very important. We do what we can to try to solve the crisis.
So in this battle, it's not bullets this military production line is making, but medicines to replenish stocks that are being used up fast.
And this is it, coming off the production line. Packs of paracetamol. Spain's military have put down their guns, and their weapon of choice in this fight now, packs of pills.
And across Spain, people everywhere are getting involved too. Designing and producing the goggles doctors are so short of. The
those stuck at home sewing face masks for the elderly. Here, a nurse posts a thank you for the vital protective visor handmade by people living near to her hospital. And that thanks is returned. Every night in every city, town and village across Spain, acknowledgement of the bravery and sacrifice the medics are making, the sound of a grateful nation.
In the United States, more than 800 people have now died, and there are 60,000 confirmed cases. Half of those cases are in New York State, where the governor has again appealed for more help from the federal government. Despite the mounting numbers, the governor said there are early signs that stringent restrictions on social gatherings and other measures could be slowing this virus's spread. Nick Brown reports.
New York is paying a price for being the world's most global city. The very thing that makes it great also makes it vulnerable during this planetary pandemic. It saw the tourists and visitors who normally throng places like Times Square. Partly explains why this has become the epicenter of America's coronavirus outbreak.